Hey everybody, this is Dr. Pat from the Springfield Wellness Center, and today we're going to talk about scoliosis. And we're going to highlight one of the therapies that we do here at the office that can help improve mobility, flexibility, and overall function with this spinal condition. So, scoliosis is a condition in which the spine has what's called a curvature. And as we get our spine model here, what we can see is that when we look at it from the back, a curvature is a curve that goes side to side. When we look from this way, it's normal for the spine to have curves that go like this. These are normal curves. A curvature in the spine is abnormal, and this is what scoliosis is. So the spine curves from side to side, and it puts a lot of stress that's unequal on different parts of the spine, including the joints, the nerves, and the muscles as well. Scoliosis is mostly a congenital condition, meaning that it starts from birth. And it's something that is usually noticed in kids usually around school age or so. And it's a condition that for many people doesn't cause any symptoms or problems, but for other people, it can cause a lot of trouble and even sometimes in some severe cases require surgery, especially when it involves compromising lung function. And so it's definitely a condition we want to take seriously. And through chiropractic and things like what we're going to show you, spinal decompression, this is a kind of therapy that can really help improve those things like mobility and movement. And so, just going to show you this here real quick. So Dana is having her spine stretched, and what decompression does is it pulls the spine with a programmed amount of weight. And so what that does is helps open up the joint spaces, open up the disc spaces, and also give those nerves more room to function. Whenever we have curvature in the spine, it can cause compression in some different areas because it's not directly lined up the way that it's supposed to be. And so with a spine that's symmetrical, we want it to be able to have space on both sides where those nerves can exit. And with curvature in the spine through scoliosis, we don't always have that. And so something like decompression can help open those things up, which can allow for movement to be easier, improving mobility, flexibility, and overall function, because scoliosis is something that can cause limited mobility over time, especially as we get older. And so it's really important that we address it through things like decompression, like chiropractic, to help maintain and preserve the amount of movement that we're getting. So decompression is an easy therapy. You lay on the table and the machine does the work for us. So it stretches for about 15 minutes at a time, and it goes back and forth between two programmed weights. And finally, when it's done, it comes all the way back down to the beginning. So it's an easy therapy. It's one of the most common therapies we do in our office for a whole host of conditions. But scoliosis is definitely one that we do this for. And again, it's to help preserve that movement and that mobility, because when you talk about the spine, you talk about scoliosis, those are things that over time can cause degeneration in the spine. And when we have degeneration, we know that's a one-way street. There is no going backwards with that. It only progresses forward. So it's really important that we preserve that movement, preserve that joint space as much as possible so that those joints can function well and you can continue to do the things that you want to be doing with your life. So if you're having scoliosis or you have scoliosis and you're looking for other natural options, decompression might be a good option for you. It might be a good therapy to help give you some of that freedom back and relieve some of the discomfort you may be experiencing. So if you found this video useful, please share it, and we'll see you on the next one.